This is the anterior side, this is the right side, this is the left side. This is the septum, the wall separating the atrium called the interatrial septum. The wall separating the ventricle is the interventricular septum. This earlobe-like are called the auricles, the right and the left auricle. This tube on the superficial is called the pulmonary trunk, and this is the aorta. Now, you see that the aorta branches into two. This one, it will branch into two. This one, those are the brachiocephalic artery. This one, because this is the main one, isn't it? Okay. Now, so the dorsal side or posterior side is, you can see, because that's where you find the, and it's flatter, isn't it?
Yeah.
Posterior side.
So the opening at in the middle is called the inferior vena cava. Above it is the pulmonary vein, and this is your superior vena cava. There, just behind the right auricle. Okay. So when we cut it here, this is the right atrium. That opening is the coronary sinus. This is the right ventricle. This flaps here, the flat one. You see the flat one there. Flat there, the flat. These are the tricuspid valve, and these are the chordae tendineae. These are the papillary muscles where it is attached to the chordae tendineae. Okay, so either left or right, you should have the part. The outer one is the epicardium, the middle one is the myocardium, the inner one is the endocardium. Now, if the question is tissue, and it's asking you the tissue, that is the trabeculae carne. If the question is ventricle, if the question is chamber, then your answer is right ventricle. Okay, so then
It is layers.
if it is layered, then epi, myo, endo. If it is a tissue, the name of the specific part. Okay, now we go to the, and then here they open up this is the pulmonary. If this probe is inserted like that and it says vessel, then pulmonary trunk. Okay, but if the question is tissue, because that is where, may I borrow a scalpel? Thank you. There. You see this flap? These two flaps, that's called the, if there's a pin here, it's called the pulmonary semilunar valve. And if this is inserted like that, that means we are talking about the trunk. Okay? Pulmonary trunk. Now we go to the left side. So this is now your pulmonary vein. Then you have the left atrium. This is the left ventricle. This is the bicuspid valve. You see that flap here? That's the bicuspid valve. And look how thicker the chordae tendineae are. And at the end of it are the papillary muscles. And look at all the folds inside, the trabeculae carne. This middle one is all myocardium, epicardium. Inner one is endocardium. Okay? And then you can also see the flap of the aorta, isn't it? That the aortic semilunar valve, this one. You see that? That's the aortic semilunar valve because it goes towards the aorta. Okay? And then if you see a hole like this one, that's the aortic sinus. On the right side, coronary sinus. On the left side, aortic sinus. Okay? Yeah, that's it.